Hey, good evening. I'm Russ Mitchell. Tonight, COVID-19 cases continue to climb across Northeast Ohio, putting more strains on healthcare systems. 12,864 new cases have been reported over the past 24 hours. That's a pandemic record high. To help put this in perspective, let's compare to where we were a year ago. On this day last year, we saw around 7,600 cases. Our positivity rate is almost double that of a year ago. The only bright spot, we're seeing slightly fewer new hospitalizations. But again, hospitals are stretched thin, from doctors and nurses to ambulances. Marissa Sines brings us the words of concern from first responders.
From those that care for you at the hospitals to those that get you there. It's a double duty job these days.
It's busy for everybody.
Cleveland's emergency medical services not immune to short staffing.
Trying to stretch the workforce out to try and do more work with less people.
Cleveland City Council President-elect Blane Griffin sending out this message Wednesday afternoon. EMS is overwhelmed, asking the community not to call for minor things. The union president for paramedics and EMT, Paul Maluish, says EMS was already short-staffed, but as COVID-19 continues to spread, it's inevitably impacting paramedics too.
I have had 2 people just today that came up positive. Every single shift is having people go home sick because of possible COVID issues. We're probably in the area of about 20 people, 25 people.
Hospitals up against the same battle.
Many of our caregivers are also contracting COVID.
Of the estimated 30,000 healthcare workers for university hospitals, the hospital says more and more employees are not just getting sick, but are feeling the weight of the workload too.
Our numbers of employee COVID cases are higher than they've been at any other time during the pandemic. It's yet another holiday season where our caregivers are going to be not only working, but working long hours, extra hours, many days in a row without a break.
Hospitals and EMS are pleading, if you're ill in a minor fashion, call your physician, so those that need their services most have the opportunity for help.
Or the heart attacks, the strokes, the debilitating injuries that we need to respond to.
EMS does want to be clear, if you need an ambulance, call. This shouldn't divert you from seeking medical attention, especially if you're in a dire situation. Now, hospitals across Northeast Ohio are posting everywhere, asking people not to inundate emergency rooms with things like COVID-19 testing or minor conditions. We've got information on where you can get tested for COVID-19 on our website, WKYC.com. Russ?
Okay, Marissa Sines, thank you.